When we first rocked up here in Blantyre, the hospital recorded annually the highest incidence of child rabies deaths from any single institution in the whole of Africa. That's why we came. Okay, buddy. Would you mind holding him, please? Good dog, good dog. Whoa.
Since Mission Rabies came, we've seen a dramatic fall in the number of cases of rabies in this hospital. In the last 2 years, we've only seen one child die in the hospital with rabies.
Fantastically, there does seem to be an impact from the Mission Rabies campaign. We're seeing fewer paediatric cases, but clearly the job isn't yet done because there are still cases appearing.
And we know that for every one case that we see, there's an iceberg phenomenon, a tip of the iceberg phenomenon. So for every one child we see, we know that there's maybe 40 or 100 children out there who have died of rabies and they've been given another diagnosis. Maybe they've been misdiagnosed as having meningitis or cerebral malaria, but they actually died of rabies, a preventable illness.
Rabies prevention and control in dogs is a public good, and it has to be really looked at from that sense in a One Health community. Agriculture, human health, the environment coming together, and in a One Health capacity, really doing something about dog rabies and not just talking about it.
I think that's the real edge of the Mission Rabies project, is because rabies is carried by dogs. 99% of all human cases are dogs, through dog bites. And in Malawi, there's at least one child dies every single day because of rabies here. But it's one of the poorest, if not the poorest country in the world right now. And nobody is obviously going to care massively about dog welfare in this sort of situation, but they do care about the children.
The rabies issues are very high on our agenda, but the problem is we don't have enough for people to do the job and the actual funding to do that.
The country which has only got a few dollars a year to spend on healthcare for each individual in the country. Rabies vaccine is actually something that's difficult for district health officers to afford. So for many reasons, there's many barriers to care. They can't access the care, or when they get to the hospital, they find that there is no vaccine and they have to go home.
We play an amazing role in helping countries overcome diseases on a day-to-day basis. We provide vaccines for diseases that are or can become endemic. Helping them to control these diseases is extremely important. This is an amazing opportunity to be in the middle of what we are doing day to day and to see it from very close and to get this first-hand experience with the vaccine.
35,000, guys. So this year, we've vaccinated 35,612 dogs in Blantyre City, which is about 1,000 more than we vaccinated last year, which is brilliant. We've achieved close on 80%, we think, when we've analysed all the final figures.
Clearly, the aspiration is that rabies will be eradicated by 2030. That's no small ask, it's no small undertaking, but you have to start somewhere, and that's what the team have done here.
Mission Rabies have done a tremendous job, but the work is not done, and we know that if we're going to prevent rabies, it isn't just a one-off effort, it's a sustained effort. It's something that has to go on and on and on and on and on for years.
Lisa siri nchiro yao panjira nchiro imene ayamba yokuti athetse matenda amenewa ifa yokuti matenda amenewa akuti chosera abale athu okundidwa pa moyo wathu.
The key message of Mission Rabies is to show the world how simple and doable it is to beat rabies and eliminate it. To gain momentum, get the support and funding required, to show how transparently that can be spent and generate direct positive results for the good of both dogs and people.